Good afternoon. I'm Shawnee Au, and this is One News Now. The Asian Hospital and Medical Center says it has reached full capacity for COVID-19 patients. The Muntinlupa Hospital is urging suspect, probable, and confirmed COVID-19 patients to seek care in other facilities for now. The hospital also clarified that non-COVID-19 patients will still be accepted and online consultations are still available. And to tell us more about the situation in hospitals, we have Private Hospitals Association of the Philippines, or PHAPI President, Dr. Jose De Grano, joining us over the phone. Good afternoon, Dr. De Grano. Can you give us a picture of how hospitals are doing right now, at least the COVID wings? Are private hospitals really hitting full capacity at the moment?
Right now, the bed occupancy rate for the whole country is already around 55%. Especially, that's for National Capital Region. But there are hospitals or facilities who have reached the critical level, and around 22 facilities have reached the high-risk level. If you reach the critical level, that means that it's almost full or more than 85% full. The high-risk level are 70% full or up to around 85%. So right now we're experiencing really the problems in admission of these COVID patients. So that's why we are advising patients that if they want to be admitted, they have to contact first the hospital or call the One Hospital Command Center.
All right, Dr. De Grano, now can you give us an idea whether or not most of these cases are mild to moderate? Should we be advising patients with just very mild symptoms or just mild cases to go to LGU isolation facilities right away so that hospitals don't get overwhelmed? What do you guys advise?
Well, I think that's a good advice, because right now around 96% of cases are mild or asymptomatic. And asymptomatic maybe around 2%. Only around 1% are severe and 1% are critical. So that's a good thing that if you're asymptomatic but you're positive, you have to consult and be transferred to a quarantine facility. Yeah.
All right. So what do you advise for people who are just finding out that maybe they're positive and asymptomatic? Should they be reaching out to their respective LGUs regarding isolation facilities, where to proceed, or maybe to get permission on whether or not they can do a home quarantine instead?
Actually, if you get positive, the LGUs will be looking out for you because when you had yourself tested, it's already in their database, and they'll be looking out for you, and they'll probably get you and transfer you to the quarantine facility, if not the hospital.
All right, so it sounds like there's at least a little bit more of a working system here in terms of tracing and tracking down positives. Now,
Yes.
Dr. De Grano, I would like to get your reaction to the consecutive days of 8,000 new COVID-19 cases. Again, 8,000 plus cases recorded today. Are you seeing hospital bed utility or use rates or occupancy rates actually getting overwhelmed with these consecutive high case counts per day?
Yes, I think especially the private hospitals are already overwhelmed by these new cases. Imagine 8,000 a day, or almost 8,000 a day. That is most of them are beyond the capacity of our private hospitals, mainly because our staff are limited. Even if we want to admit more than 20% of our bed capacity, we are limited with a number of staff that can manage these COVID cases.
All right, so apart from space and just geographic locations to put patients in, Doc, another issue is healthcare workers. Any suggestions on how to augment the number of healthcare workers in hospitals in order to prevent fatigue from those on duty and to cater to, of course, more cases?
I don't know if they will be able to do that because there are no more nurses available. Actually, for the past 4 years, there are no new nurses. And now they are letting the nurses go out of the country, go to overseas, and some are transferring to government facilities. So the private hospitals are left with very few nurses at the present time.
That's right. Somewhere in the middle of last year, Dr. Degrano, healthcare workers actually made an appeal to government to have a timeout for 2 weeks, and the government complied. Are you in favor of doing that again now? Is this a possible solution to the problem? What do you think?
Well, presently, I think it's still manageable, but if the trend goes continues and it cannot be abated, then that may happen. But right now, I think that the advantage right now is more or less the doctors know what to do. The cases are more or less in the mild form, and so more or less they are manageable right now. But we don't know if the beds get into really full capacity. So that will be a big problem for everybody.
I'm sure, Dr. Degrano, that you've heard about the new quarantine restrictions in effect here in the NCR Plus region starting today. Do you see these new restrictions help bringing down cases in any way?
Well, I think that will help a lot because at least I think that will prevent the spread of the diseases or the virus.
All right, thank you so much for your time. That was Dr. Jose Degrano, president of PHAPI, on the line. And not even senators were spared from the confusion on the new quarantine restrictions imposed in Metro Manila and nearby provinces. For the details, Mean Los Baños joins us live from Rizal. Mean, what's the latest from senators?
Hi, Sean. Good afternoon. You're right. Several senators are actually puzzled by the new stricter restrictions being implemented within the NCR bubble. One senator, Sean, is actually proposing to abolish IATF for its supposed inefficient handling of the pandemic. Senators made the remark after the IATF released new and stricter quarantine policies 1 year since the first lockdown. For Senator Ping Lacson, the NCR Plus bubble setup should have been announced earlier to give businesses ample time to adjust their activities. Senator Win Gatchalian, meanwhile, is proposing more interventions such as strict localized lockdowns and ban on gatherings, even those only involving 10 people. For her part, Senator Amy Marcos disapproved of the different terms for community quarantine as they are only causing confusion. Marcos also proposed abolishing the IATF and have them replaced with public health experts at the helm of the COVID-19 fight. Senate President Tito Soto, meanwhile, pinned the blame on quarantine violators. But he is expecting cases to decline since vaccines are already available. Sean, Senator Sonny Angara, for his part, said that he understands the stricter quarantine restrictions being implemented by the IATF, especially because hospitals are now being overwhelmed by COVID patients. Sean?
All right, thank you so much for that update from Rizal. That was Mean Los Baños of News 5. A newly minted doctor tested positive for COVID-19 just before taking the board exams and emerged as one of the top notchers. His story in this report by Ria Fernandez.
The COVID-19 pandemic has brought a great deal of challenges on newly proclaimed physicians. Among these is the insufficient training due to the suspension of medical internship. But the virus did not cower Dr. Christian Orante as he secretly continued his duty at that time.
Kasi feeling namin, yun yung tama eh. Yun yung dapat na ginagawa bilang isang doktor. Parang kahit hindi pa kami nag-o-taking, parang yun yung purpose namin as physicians.
Di po namin alam ng mag-asawa, kahit po nung year 2020, pumapasok pala siya sa PGH kasi gusto niyang tumulong.
When the lockdown eased, Dr. Orante went back to his hometown in Bicol to finish his review and take the board exam. Unfortunately, he tested positive for COVID-19 upon arrival, but he still luckily passed the exam when he took it, emerging as the top 4 in the ranking.
In the facility, nag-start talaga akong sabi ko, mag-aaral ako kasi wala naman ako iba pwedeng gawin. Pero ang hirap po talaga mag-focus. Parang nakakasira sa mental health yung mag-isa.
Meanwhile, third placer Dr. Sai Johan Romuga coped by playing online games.
Kailangan ko kasi ng parang pang-cool off ng utak kasi mas stress ako. Tapos kung palagi kang nag-aaral ng straight, tapos hindi mo na ma-retain, parang pointless naman.
Board exam top-notcher Dr. Jeremiah Lim, who is an avid Dota player, has this reminder to the young ones.
Mas unahin mo yung pag-aaral, tapos yung laro, tingnan mo na lang sa parang break time mo. Wag mong gawing laro muna bago aral. Kasi yun yung ginawa ko dati, ay mali yun. Ang unahin mo, aral before laro.
The new doctors have started preparing for their return to service, especially now that they are most needed in the battle against COVID-19. For News 5, Ria Fernandez, We Are One News.
For more updates, visit News 5, the Philippine Star, and Business World online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on the Signal Play app. Register for a free account at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Sean Yao. We are One News.